146 confirmed cases, cumulative cases of coronavirus in Victoria. That's 410 new cases since I last updated you. I'm terribly saddened to have to inform you that the total number of people that have died as a result of this pandemic is now 267 in Victoria. We, of course, extend our best wishes to each of their families, our condolences, our sympathies. This will be an incredibly difficult and challenging time for them. The information I can provide you is an age and gender breakdown. So there are 2 females and 1 male in their 70s, 6 females and 5 males in their 80s, 5 males and 1 female in their 90s, and 1 female in her 100s. 16 out of those 21 deaths can be linked to aged care outbreaks. There are 662 Victorians that are in hospital. 43 of those are receiving intensive care and 25 of those are on a ventilator. We have conducted in total 1,874,615 tests. Those results have been received by us. That is an increase of 19,927 results since yesterday. There are 2,961 cases with an unknown source. That's 58 more than yesterday, 58 more of those mystery cases. There are 1,079 health workers who are active cases. There are now 1,929 active cases in aged care settings, and that means the total active cases is 7,877 across Victoria. Just on regional metro split, if I can, as at the 11th, if I can just make a couple of comments. We have seen some increases of concern to us in Geelong, Ballarat and Bendigo. They are stable, they're very low numbers, but coming off such a low base, any additional cases are of concern to us. So I suppose the point that I would simply make to people right across regional Victoria, you've done a great job in following these rules right throughout the pandemic, but it's really important that each and every regional Victorian stays the course with this. I know it's tough, I know it's challenging, I know that we would prefer to be in a different set of circumstances, but even at low numbers, we've just got to have that vigilance across the board so we can keep them low and indeed drive them down even further. I made some comments yesterday about people really just stopping and thinking about whether travel to regional Victoria or travel from regional Victoria to metropolitan Melbourne is absolutely necessary. And I just ask people to give that little bit of extra thought to that, and if there's any sense that that trip could be avoided, that travel could be limited, well then that is conducive with less movement, less cases, and getting to the other side of this. Those stage 3 restrictions are being followed by the vast majority of regional Victorians. I suppose I'm thanking them, but I'm also just indicating that we have seen a few new cases, and we might be able to provide you with some further detail about those at a later point. But this is really an endurance test. People are frustrated. People are obviously wanting to go back to find that COVID normal. That's not for now. That is still some time away. And all of us, whether we be in Melbourne or in regional Victoria, need to apply ourselves to that task. We need to stay the course. We need to make sure that we're not letting this virus win by us not following those rules and making choices that contribute to its spread. Now, I've got a series of important updates that I want to take you through, and I think they acquit many of the matters that we spoke about yesterday. So just bear with me as I go through a number of these different areas. They are areas of interest to all of you, I know. Now, in terms of aged care shifts that have been carried out by nurses, so hospital nurses, we're up to 1,277 shifts that have been filled as at the 11th in private aged care facilities. That's a massive task, an enormous task, and I'm very grateful to each and every one of those nurses and personal care workers for stepping up and working in an environment that is not their environment. That's not what they're paid to do. They've in fact gone beyond that and gone into some very challenging places, some very confronting scenes, but they're doing us all proud, and we're very grateful to each of them. I can confirm for you that 406 aged care residents have been transferred from residential aged care to hospital due to coronavirus outbreaks. The majority of these patients are positive, cases. Now, in terms of active cases, if I can just give you a little bit further breakdown, just so there's a better understanding of the challenge that we're facing. Total active cases 1929, then active cases in public aged care, public sector aged care, Victorian government run aged care is 6. Active cases in private aged care 1,923. Active outbreaks, there's some 122 of those. Active outbreaks in public aged care, 5 of those. 2 outbreaks are co-located, they're essentially part of the same facility. And active outbreaks in the private sector, some 117 cumulative outbreaks. The total number of cases across the board in aged care, 2,665, and there's a very significant challenge there each and every day. Whilst we've seen some stability come to some centres, some facilities that were in absolute crisis, everybody's working together, everybody's very much focused on trying to stay ahead of this in these settings and not have a situation where we see a repeat of some of the really difficult and tragic scenes. To that end, each evening there are meetings between Department of Health officials from Victoria, those from the Commonwealth. Various ministers are briefed on that each evening. They're part of that. For instance, I think the Federal Aged Care Minister is part of that discussion each evening, briefed about what has occurred that day, what the plan for that evening is, and any other commentary that's important. And I think a sense of all the different important operational decisions that have been made that day or that are in process, they are shared. That level of communication and partnership is very, very important to keep the most vulnerable in our community safe. Moving on to residential disability outbreaks, which I know have been of interest to each of you. We have active cases in NDIS homes, which are community residential disability accommodation services, some 56. Active cases in what are known as transfer homes, those that are state government funded but are on track and are part of a process to fully transition to the NDIS scheme, 24. Active cases in state government funded homes, 1. Residential cases, so amongst clients, 20, and staff cases is 61. So again, that is challenging, but we have again a really important cooperative partnership. There is, if you like, the mirror or the sibling incident control, centralised command and control body that's been set up down at the State Control Centre to similarly coordinate our response in disability care as we have done and continue to do in aged care. Any cases amongst vulnerable groups are a concern, but I think it's important to note that there is a really important partnership and one that I think has served us well and will continue to when it comes to those settings. Now, we do know that we have a growing number of health workers, so today's update was 1,079 healthcare workers who are active cases, and I understand that is of great concern to them, to their families, and indeed to every single Victorian. Those who care for us, we have to do everything we can to take care of them. I'm going to be able to provide you early next week with a very detailed breakdown of workforce transmission. So who's getting the virus to the best of our knowledge and detailed analysis, how they're contracting the virus. That work is currently ongoing, and it is quite a complex task to essentially track back to that index case each and every one of those healthcare workers. But I do hope to be able to, and I'm very confident I will be able to give you both a breakdown of different roles and functions within the health system, but also a sense of whether people are getting the virus at work or whether they're getting it in other settings, patient to staff transmission, staff to staff transmission. All of that work is being done at the moment. I can, however, confirm that our early analysis by our expert team is showing that the majority of healthcare workers are acquiring coronavirus outside of the workplace. I'm not making any judgments about that. That just is what the data is telling us. There is further very detailed analysis going on at the moment, and it is my expectation that I'll be able to give you give you a table with lots of different data and information and a breakdown early next week. If I can do that any earlier, then of course we will. Continuing, PPE, I know there's been a number of issues in relation, there's been concerns raised about how PPE is essentially distributed from the centre, from our stockpile out to hospitals, and then how it's distributed within the hospital networks. What I can confirm is around 68 million gloves, 19 million surgical masks, 2 million face shields. They are ready to be distributed to health services whenever they are needed. Our hospitals, they make requests for PPE on a daily basis, sometimes more than once per day, via a dedicated online portal. The standard is for orders that are received before 11 a.m, so an order received just an hour ago, that will be shipped out to the hospital by the following day. 98% in fact of those orders are received by the hospital who ordered them if the order is placed before 11 a.m. the following day. It can take a little bit longer if an order was to come through in the afternoon, but I think when you're talking about these sorts of volumes, to be able to achieve that 98% successful delivery rate in good time, I think that is a credit to a big team of people who are working as hard as they possibly can. If people are interested, I can certainly take you through total numbers. In fact, I will, just for the purposes of clarity. There are 2,173,507 face shields that have been delivered out to health services. Doesn't mean they've all been used. Some of them will be sitting in, if you like, mini stockpiles at local hospitals and health services. 89 million, I'll round these numbers off because they're almost 90 million gloves, just under 5.5 million gowns, about just under 300,000 hand sanitizer containers, just under 3 million N95 masks, and about 37.5 million surgical masks. That's what's been taken from our stockpile over the journey. That's since March this year. They've been all delivered out to health services. The majority, well, certainly the majority of that will have already been used. Some will be held in reserve. It's not quite a just-in-time system, although given that we're getting 98% of those orders out the next day, it almost is. Just in terms of orders that we have placed, some of which we have received already, some of which will be in process. You have, to give you a couple of examples, 14.5 million face shields, 26.5 million gowns, 154 million surgical masks. The list goes on and on. It is a very significant task, a very significant undertaking, and there is literally a massive team of people who are making that function as good, as best as they possibly can. And I would just say as well, despite those numbers and despite the impressive nature of that work, we're always about listening and trying to best understand any concerns, any pinch points, any challenges. It's a big system, so of course there will always be issues that have to be followed up, but it is a very strong team, and one that's working hard to get to order from the rest of the world what's needed, to distribute it to hospitals as fast as possible, and then in each hospital there are dedicated teams who are about distributing that PPE out to the wards, to each of the different health professionals and other staff who need that protection, and indeed their patients who need that protection across that hospital community. We've had a bit to say about vulnerable Victorians and the provision of masks since we put in place the compulsory wearing of masks both in Melbourne and then Mitchell Shire, and then of course statewide. I can confirm that 3,078,800 single-use masks have been sent to dispatch. The vast majority of those will be out. There are others that are still waiting to be processed. That's just a snapshot in time moment. This is as of close of business last Friday, so I expect most of those are out probably by now. And the number of reusable masks, this number will grow quite steadily as our production continues, but it's just under 171,000 masks that have been sent out, the reusables. That's for vulnerable communities. I think we've had quite a significant discussion about that, so whether it be local government, community health centres, Aboriginal controlled health organisations, etc., that is about making sure that those who, for one reason or another, their position, their circumstances means they may not be able to go and purchase a mask, or they may not be able to make one. So we either give them reusables or the single-use masks to get us through till the balance of those orders, which are in excess of 2 million masks, are with us. Now, the final thing I wanted to update you on was workforce breakdowns, which I know has been of great interest to each of you. I don't want to feed your expectations that I'm able to go through every single workplace setting. What I can say, though, is we have got the first cut of a really significant piece of work, and where a person presents or where a person works, for instance, is not necessarily where they got the virus. So tracking back to the absolute source, trying to have a situation where it's not just where you had it, but where you got it from, that's a good deal more complex than it might seem. But I would hope to be able to provide you quite soon with a detailed breakdown across the following types of settings: aged and residential care, schools, hospital and healthcare, student accommodation, backpackers, social settings, for instance, childcare, disability settings, food premises, correctional facilities, laboratories, other primary family home domestic settings, and then their outbreak categories. And then from a workplace point of view, warehouses, food distribution, retail, office, abattoir, supermarket, logistics, so on and so on. There's quite a bit of work that needs to be done to settle each of those numbers, but that's the type of data I'm hoping to be able to provide you quite soon, which I think is what you've sought and what is available. But again, I just make the point, having a clear understanding. We know who's got it, we know where they were, but we don't necessarily have in that fine detail and the exact details of how they caught the virus. And without that, it's hard to then attribute it to whether it's at home or whether it's at work or in some other setting. But I just wanted to reassure you that work of that nature to deliver that sort of product is well underway, and we'll be able to provide that to you as soon as possible. Just finally, before I take your questions, I would just again extend my thanks to every single Victorian who is following the rules, whether it's traffic data, just anecdotally moving around the community. You can see there are just but a fraction of people out, as would be normal. That is very difficult, it's very challenging, heartbreaking in some ways, to see empty streets and to see workplaces without any employees there. But if we don't drive down movement, we simply won't drive down these case numbers. Without these restrictions, we have zero chance, absolutely zero chance, of getting to the other side of this anytime soon. It won't be a 6-week strategy, it'll be much, much longer. We'll be into 2021 with still really significant lockdown in place. That's not acceptable. We've got to try and break this, try and beat it, or at least better it over these next 6 weeks, and then start the process of cautiously opening up. We are equal to this task, all of us. It's a wicked enemy. It's an incredibly challenging enemy, but silent in many ways. But Victorians are strong, Victorians are united, and Victorians, I think, understand, as frustrating and as challenging as this is the only way forward. It's what experts tell us we must do. It's what logic tells us we must do. And provided we keep looking out for each other, provided we keep dealing with this as we have dealt with many other challenges, albeit this is unique, this is of a different order, but we are, I think, strong enough and united enough to get past this. But we've all got to make the best choices. Get tested if you have symptoms. Wait at home until you get your test results. If you are positive, follow the advice you're given. Every other Victorian, the rules are there to protect your family and every family. The rules are there to protect all of us, and the rules are there to get us to the other side. Can I thank again the massive team of people, many, many thousands of people who are working day and night, and the vast majority of Victorians who are doing the right thing. It should be a source of pride at an individual level, and it should be a source to motivate us to keep this going, to stay the course so that we can get to the other side of this second wave. Happy to take any questions you have.
I mean, you're hoping that numbers might have been driven down a bit further than this. It's obviously flattening the curve, it's still not really.
Sure, well, it's certainly flattening it, and we have seen, if you look at the average over the last 7 days, we are seeing the line come down. Ultimately, tonight at midnight marks 1 week of the most significant elements of the stage 4, so workplaces. That's what really drives down movement, and certainly movement that's much more connected to the transmission of this virus. To that end, we all know that a week is not the life cycle of this virus. It's certainly longer than that. Now, at the same time, I'm not predicting that in 2 days' time we're going to see a number that we can pin everything on. This is not precise. It's not exact, because it's all dependent upon literally hundreds of millions of individual choices and decisions that each of us make every single day. You can't get a more variable set of circumstances than that. But with compliance up, and again, thank you to those Victorians, a larger number, I think, of Victorians who are doing the right thing, and these measures in place, our experts remain firm in the view that this will drive the numbers down. Now, how quickly that happens, that to a certain extent is in our hands as to the decisions that we make, and that's what's terribly, terribly challenging. And as I've said a few times, it's heartbreaking to see empty streets, empty venues, to see workplaces that don't have any workers in them. It's heartbreaking, but it's what we must do, and it's what will get us to the other side of this.
Secretary of the Treasury at PAEC this morning
Yes.
said they're working on the assumption based on the Chief Health Officer's advice that we'll move from stage 4 to stage 3 in mid-September before moving to stage 2 after September. Can you walk us through?
Well, I think the key point, Samaya, is that the David Martinez, the Secretary of the Department of Treasury and Finance, he will model on whatever is most certain. And at this stage, we've got stage 4 running for a period of time. He's used that period of time and then modelled what that looks like. He will then have had to make, he and his team will then have had to make other best estimate assumptions about what settings are beyond that. The thing about modelling is that it is all dependent upon the underlying assumptions you make. I know modelling is important. It is very important, but what is more important and has always guided me much more is the actuals. So what's not what you think is going to happen, not a theory, but the actual practice, what's actually occurred. And that's why, for instance, we can perhaps make more, we can draw more conclusions from actual case numbers over the last week than we can trying to predict what next week looks like, let alone what was the time frame you used? September, and then after that. So that's, we're into October. I would love to be able to confirm for you what we're going to be facing in October. We can't know that. We can only assume. That's what assumptions and modelling's about. I think the real data is the key here, and off that modelling, off international experience, from logic and from science, the science of this virus, our experts remain convinced that this strategy will work. But I would just say that's a theoretical issue. The practical delivery of this strategy really does depend upon literally millions and millions of decisions that are made by individuals and families each and every day. That's why we all have to, we've just got to find a way to stay together. We've got to find a way to stay strong, and we've got to find a way to get to the other side of these rules, to stay the course, as it were. We are staying apart. That's critically important, but that sense of unity has never been more important, I think. That's really, really, really central to this strategy working.
The Treasury is using this modelling. Is there any other government department also, planning for the future based on this modelling?
Look, I think that every government agency and department would be doing their level best to try and plan for the future, but I suppose what I'm saying to you is that that is a theoretical model, and you can only plan to a certain extent. This thing is wildly dynamic, it's wildly infectious, and you can't have a static response to it. So I'm not in any way criticising modelling, it's very important, but I think it's limited, and it's only the actuals that matter.
And the theory side of this theoretical model, what does it propose or theorise?
Oh, to be honest, I'm not briefed on the latest of that modelling. I can't tell you how many modelling reports I get. That modelling is obviously important, but modelling that's much more about the fight against the virus and the science of this is probably dominating a little bit more of my thinking at the moment, because unless and until we get the health problem fixed, then it'll be just so difficult for us to begin the program and the process, adding to the work we've already done to try and repair the economic damage that this pandemic has done.
You talked about the importance of that sense of unity.
Yes.
Is that sense of unity impacted by the opposition asking you to resign?
Whatever the opposition call for is not relevant to me. I've got a job to do. Their politics has got nothing to do with this global pandemic.
But does it have anything to do with the community sense of
Well,
unity?
that'll be a matter for the community. I would have thought it was pretty obvious who was focused on the politics and who's focused on the global pandemic. That's my job, and I won't be changing my approach.
Can I ask about the pandemic then? You put out
Yes.
some numbers yesterday that 10 to 25% of people have not been contacted in the first 24 hours since they received a positive result. So that reads like
No,
one
that's-
in four people haven't been
No, I
contacted.
think
As
that-
many as 1 in 4 people haven't been contacted.
No, Ralph, I think that relates to close contacts over a 48-hour period, not cases within 24 hours.
Well, the email that your department sent out said 10 to 25% of people
I read
of
you.
new cases are
I read-
awaiting interview at 24
I
hours.
read. Now, hang on a minute. I read you. We'll go through both then.
Yeah.
I read you out some numbers. I spoke at in another setting yesterday about our national dashboard, the contribution we've made to the national dashboard around contact tracing. We're getting to all of our cases within 24 hours, and that's now a combination of both calls but also going out and door knocking people. There are a number of people who, that's contact. In terms of interviews, there can be a number of people for whom we just can't find them. We just can't get them to agree to be part of an interview for whatever reason. I'm not making a judgment, but there is also, when you look at the total number of cases that are in aged care, that is 1,929 active cases in aged care settings, there will be many, many of those aged care residents who are recorded as a positive case, but we don't try and have an hour-long interview with them.
Yeah.
That would just not make any sense.
So if I can just ask about that metric, if as many as 1 in 4 of the contacts are not spoken to in that 24-hour period.
Well, their relevant time frame is 48 hours. That's the national
I just want to
benchmark.
get a sense if that has improved over time, and if you think that time needs to come down to actually get the
Sure.
daily case number down.
Sure. I can't give you an historical perspective on that. I'm happy to try and do that. What I would say though is every day we're looking for minutes and hours if we can find them. Continuous improvement, and that's challenging even if you had relatively stable numbers, even low numbers. Like there's countries around the world, some quite close to us, that have got cases today for the first time in a long time. They'll be looking to run the most efficient contact tracing they can possibly do, and they may do things differently. They may do more than what they did in the first time. Other states, I'm sure, are doing the same thing. We are literally, you kind of pull the thing apart every few weeks, look for different things you might be able to improve, put it all back together, and then move to the next phase. To do that while you've got cases going up, or even if they're stable, 400 cases, that could be as many as 2,000 close contacts. You throw in workplace outbreaks, then you're talking about many more than that. It's a big job, but I suppose my answer to your question is every day. And I think you and Wallace would have spoken. I didn't see the hearing. Haven't read the transcript, but I would assume you and Wallace, who's a very well-respected clinician, someone I've known for a long time, he would have spoken to some of this yesterday when he was giving evidence. It's that continuous improvement, and I wouldn't rule out making further refinements, further changes, because every day we're looking for those extra minutes, so to save that time to get to people quicker.
Just one more, forgive me.
Sure,
just
no worries.
looking back,
We could do all of them.
would it have been better, and was it a possibility to ask the ADF for public health people, those more senior contact tracers, so not the nurses who do the 24-hour interview, but the more senior public health positions that it seems we did not have enough
Filled
of?
by the ADF.
Was it ever an option? I'm not sure the ADF had those people, but was it ever an option to ask for those people from the ADF?
Yeah, I would not. So just in broader terms, well, I'm happy to be specific if people want me to. The only quarrel, the only argument, the only fight that I'm interested in and engaged in is against this virus. So I'll be incredibly careful. You've asked me a fresh question. I don't read this in any way, and no one should ever have read in any way that I was critical. But I just want to be careful that no one reads into what I'm about to say. I'm not certain that the ADF have that sort of public health physician, those sorts of people. We've asked for medical teams, and every time we've asked, we've got exactly what we asked for. It does take some time. You can't. It's not just a switch that you flick. We've got hundreds and hundreds of ADF personnel out on the ground as we speak now, knocking on doors, senior people doing work in the State Control Centre, all the way out to mobile testing sites, across the board, and we're deeply grateful to all of them. They're doing a sterling job, and I would just make the point, they've been here since, some of them, not all of them, but some of them have been here since just before New Year's Eve, when I asked them to come. I actually requested them to come. I think that's what the record will show. And then they went to Mallacoota, and they helped get people out of Mallacoota in the fires. I know that seems a long time ago, but ADF have always been there for us, and we're very grateful to them. Very, very grateful to them. On the issue of capability, let me go back and check. I'm not entirely sure that they could fill an order like that. That's not a criticism, but that's not necessarily what they would do. I think it's pretty fair bet that any public health physician who is prepared to be part of this response is on the tools. They are there doing that important work. I don't think there's too many of them that have said no, and that's why we're so grateful to them.
Now, the ADF yesterday that the ADF wasn't offered to help with hotel quarantine, but then the Defence Minister released a timeline that it was on offer. Do you still stand by your comments?
Well, you seem to have missed one important statement in the construction of events. The Emergency Management Commissioner, Andrew Crisp, has issued a statement as well, and I would direct you to that.
His statement doesn't address the June 24 events. He's addressing events in March and April. You said yesterday that it would be a matter for him to address the fact that he did make a request on June 24.
Yeah, that's right.
Why hasn't he addressed that this morning?
Well, you'd need to speak to him about that. But I would make the point to you that June 24 is about a month after the outbreak at Ridges, so this will be borne out by others. But I think that the notion that would have been in any way material to the challenges in hotel quarantine, I think, is not right. That's a month after Ridges, so we can deal with that. There are other processes that will deal with that. But again, Emergency Management Commissioner Crisp, who I know and who I think Victorians know very well for the leadership that he's provided whenever he's been called upon to do that, he's issued a statement, and I would direct you to that. Again, I'll just make the point, so there's simply no doubt whatsoever. The only quarrel, the only argument, the only fight that I'm engaged in or will ever be engaged in until this is over is the fight against this virus. We are deeply grateful to the ADF and the Commonwealth Government for the contribution they're making. I can't speak to statements issued by the Defence Minister. That's entirely a matter for her. But I can direct you to comments, very clear comments made by Andrew Crisp, and you would need to draw your own conclusions from that.
Your press release from March 27th.
And then we'll go over here. Yes.
Sorry.
Yep.
Your press release from March 27 says that it's been agreed that the Australian Defence Force will be engaged to support the implementation of the hotel quarantine arrangements.
Yep.
Why weren't they, given that you said you were going to in that press
No,
release?
I don't think I don't agree with the way you've constructed it. The release that was issued directly after the National Cabinet decision to establish hotel quarantine is one thing. I think if you look at Andrew Crisp's statement, he talks about ADF being involved in the establishment of the program. So I don't see any inconsistency there at all.
Can you walk us through the discussions or the conversations Andrew Crisp had with the ADF in late March and April?
I know I can't walk you through the conversation.
We asked him, but although he is the Emergency Management Commissioner, he hasn't fronted a single press conference over the coronavirus pandemic.
Well, he's very busy. He's very busy doing a lot of very important work.
He was also busy during the bushfires as well. So maybe can you walk us through what the Defence Force told?
No, I'm not going to be. Look, I'm not going to be here interpreting these matters. The Defence Minister has issued a statement that claims various things. The Emergency Management Commissioner has issued a statement that provides the facts of the matter. I really can't offer any more than that, other than to stress yet again, I can't speak for the Federal Defence Minister. I can't speak for statements she's made. That's entirely a matter for her. What I can do, though, is be really clear with you that Andrew Crisp has issued a statement. I don't think it could be clearer or plainer, and people can make their own judgments.
I suppose the question is, why was the ADF and police officers used in the New South Wales hotel quarantine program and then not in Victoria?
Well, that's not the question that the Federal Defence Minister posed. Not the question at all.
I suppose it's
Nor is that a question that. Nor is that a question that.
it's just a question that hasn't been answered.
Well, then you'd need to speak to the New South Wales government, because you're asking me about why did certain things happen.
I suppose that's the big difference, though.
Well, again, the exact nature of that difference, you'd need a very clear understanding of exactly what happened in New South Wales, and they'll be the people that'll be able to put that to you.
A clear understanding of what happened in Victoria.
And that's why a judicial inquiry's been set up.
You can't speak for the Defence Minister or for Andrew Crisp, but your comment yesterday said that the notion that there were hundreds of ADF on offer and that someone said no is not the case.
Yep, which is exactly what Commissioner Crisp has confirmed today.
Was it your
he's-
idea?
He's confirmed that he didn't ask for them until June to come down to security, but were they available in March?
No, let's be very clear about this. The Defence Minister yesterday decided that she would issue a statement. She's perfectly entitled to do that. It made a number of claims. Andrew Crisp has issued a statement that I think is at odds with that. And for my purposes, that clears the matter up. I don't know the Federal Defence Minister. I don't deal with her. I deal with the Prime Minister. But I do know Andrew Crisp, and I think Victorians know Andrew Crisp as well. And I direct you to the really clear statement that he's issued.
The Prime Minister said in his March press conference that the ADF would be on hand and be available. So that's what I'm asking in terms of just being clear. Were the troops available to assist in security in March?
Well, the availability of ADF resources is not something that I can speak to.
Yesterday you said no, that they weren't.
No, yesterday. No, let's be very clear about this. And we can stand here for as long as you want. Let's be very clear about this. It has been consistently put to me that me or others have consistently said no to help. That's simply wrong. That is simply wrong. And the notion that that has occurred, that's just not right. And that is what I was going to yesterday. I was asked a question, why'd you do one thing and not the other? What I was saying was I'm not entirely certain that the other was on offer. And Commissioner Crisp, I think, goes directly to that. That shouldn't be read as a criticism. Neither my comments yesterday nor at any time during this pandemic have ever been, or could reasonably have ever been construed as a criticism. Absolutely not. They're doing a sterling job. And while they were out doing that work, others decided to issue a statement yesterday. I can't speak for that. Not under my hand, not under my signature. You'd need to speak to the Federal Minister about that. I think Commissioner Crisp has been very clear today. My only regret is that he's had to take himself away from other important work to be issuing statements.
Troops have only been involved in numbers, in high numbers, for a couple of months in Victoria. It does really seem to have been a theme throughout the pandemic that Victoria has been, on the face of it, reluctant to involve the troops.
Well, that's just not right.
Absolutely necessary.
That's just not right.
That is absolutely the appearance of it.
Well, how it appears and the facts are not always the same thing.
Well,
Can you
Premier,
confirm
why
that in
don't
March
you
then that you
clarify
did
then?
consider it?
Why don't you clarify
Sorry?
then for Victorian people?
I think I have clarified it.
why
I've just
Why
indicated.
you didn't ask ADF involvement much earlier in the pandemic?
No, that's just not right. We've had hundreds and hundreds of ADF personnel in Victoria for more than 2 months. They've been here for a lengthy period of time. Some of them have been here from when I first requested ADF support in the bushfires between Christmas and New Year. So I'd simply say to you that how this looks, I'm much less worried about that. In fact, I'm not concerned about that. What I'm concerned about is doing my job, driving these numbers down. If others have got time to be issuing statements which are then contradicted in pretty clear terms by the Emergency Management Commissioner who's on the ground doing this work, well, that's great. I'm glad they've got enough time to do that. I'm glad there's other people who think the best contribution they could make is to be playing politics. As Raf asked me before, I haven't got time for that, and I'm certainly not interested in it.
Who think that maybe we wouldn't have this second wave if the ADF had been called in earlier?
And people are entitled to their views. What I'm putting to you are the facts of these matters, and we're going to keep working hard in partnership with the ADF. That's the great That's in some respects the most disappointing thing around appearances. I wouldn't want any Victorian to think that the ADF were doing anything other than a sterling job alongside a big team of Victorian public servants, other Commonwealth public servants, people from emergency services. We're all working very closely together, and we're very grateful for the support that we have. And that support has been long-standing. It has built up over time, and different roles. For instance, we had many hundreds of people that were involved in the testing blitz that we did, running big testing sites. We've had people who are experts in tasking, logistics, planning. They've been at the State Control Centre for the entire journey. We've got people from Emergency Management Australia in there as well. It's a big team. The need changes, and so too does the profile of staff. And that's why we've seen numbers grow, and they've not grown in the last couple of months. They've grown, albeit in different increments, across the whole journey. They've been here. We're grateful, very grateful that they're here. And if we need more in the future, we'll be certain to ask. And you know what? Regardless of statements issued from Canberra, the most important thing is the dialogue I have, the ultimate dialogue with Canberra, and that's me talking to the PM. And every time I've asked for something, the answer's been yes, and I'm very grateful to him for it.
There's been a lot of public reporting, but no confirmation, that the hotel quarantine idea was first raised by you at National Cabinet. Is that true?
I've got to be a bit limited in what I say about National Cabinet, but we had a program already stood up in its early stages around vulnerable Victorians. We didn't think that it was appropriate to have what's now turned out to be 20+ thousand people flying into Melbourne just on a kind of honesty basis going home. We thought that there would be a percentage that would not do the right thing, and that we would finish up with many more infections. We put that case. It was agreed by our First Minister colleagues, and then we set about actually delivering on the specified timeline what National Cabinet had agreed to.
So that's a yes. You were the first to raise it.
Well, again, I'm not going to be running a blow-by-blow of National Cabinet, even if I wanted to. That's not necessarily something that I'm allowed to do. It is essentially has the same status as the federal cabinet or our cabinet, and it's really important that I don't in any way undermine the way that process works. It is a very free-flowing discussion. It's a very frank place. It needs to be, given the subject matter that it's dealing with, and there are rules, and I'm not about breaking those.
Are you essentially saying that hotel quarantine was an adaptation of the system that you had in place for providing shelter for family violence victims? Is that what you're getting at with saying?
No, I just made the point yesterday that we'd set up hotel accommodation, and it's not the first time I think I've made the point. We set up hotel accommodation for a number of different groups. It was then expanded to take care of return travels. That's the point that I'm making. Sorry?
What were those groups?
Well, as I indicated yesterday, I think there were some vulnerable Victorians, and one example, not exclusively, but one example would be those who were not safe if they were to stay in their principal place of residence for whatever reason. Others were health workers who needed to isolate away from somebody who was infected, or needed to isolate away so that they weren't infecting vulnerable people in their household. I'm sure there are some other examples as well, but that was essentially the program. It was then scaled up. Exactly what has gone on here in finer detail, there is a separate process to deal with that. I'm trying to be as direct as I can, but there are some matters that we just don't have clarity on, and that's why we've set up an inquiry, not to avoid those answers, but to get them.
And just to clarify things, would your office be able to provide a list of the numbers of ADF personnel who were engaged in Victoria and what they were doing since the beginning of the pandemic?
I'm sure we can have a look at providing that. I think I've spoken and stood here many times and talked about the different roles that ADF are playing, and the different requests that we've put in place, or the different agreements that we've entered into with the Commonwealth to provide additional numbers. For instance, I think, although I would stand to be corrected on whether it was 5 days ago or longer, but I think about a week ago I stood here and indicated to you that I'd sought from the probably was longer actually, I'd sought from the Prime Minister 500 plus additional ADF to support that, in the main, the door knocking effort and some other tasks. Answer was yes. Can't tell you whether they're all here yet. I think it does take some time. But if we can get you a breakdown of ADF on the ground, happy to.
Premier, there's a big difference between domestic violence survivors who are allowed to leave freely and potential COVID positive patients who need to be secured in their room for 2 weeks effectively. So when you say it was scaled up, what thought was given to the infection control processes as well as the security? I don't think we're expecting exact science here, but why we're trying to understand in terms of the security decisions made in March. What was the thinking around that when you were...
Well, Mark, I take you back to the preamble to your question. It would be wrong to assume that it was only people who could move about freely. No person with this virus can move about freely, regardless of... Well, no, that's what you did say.
No, I was saying if it's a scale-up of the domestic violence survivors as well as doctors who need to isolate away from their families.
Some of whom are positive. So that's right. I'm not looking to have an argument. There are a number of people in that scheme. There are a number of people in schemes as they operate right now. Some of whom are there and don't have the virus. Others do. So there's been limitation on movement and therefore security. And a sense of control in that environment right the way through. So I think we're in furious agreement. The additional scaling up, the adequacy of that or otherwise, that is a matter that's being looked at by another process. And unless I were to go and read all 106,000 pages and essentially conduct an inquiry myself, which would, of its logic tells you, that would mean I wouldn't be standing here, I wouldn't be doing the other 10 meetings I'm doing a day and all the other stuff that I'm doing. So that doesn't make any sense to me. And I know it's frustrating. I know it's frustrating, but the key point here is that Judge Coate required more time. If you make a commitment to give Judge Coate everything she needs, then when she asks for an extension, you have to say yes. And that's exactly what we did.
Have you spoken to the Prime Minister about the comments made by his Defence Minister?
No. And frankly, I think the chances of me wasting his time or mine on that media release or statement or whatever you want to call it are very low. When we next speak, or text, or WhatsApp, or whatever the communication method is, it'll be about matters that are altogether to do with our partnership, the fact we work incredibly hard together to get to the other side of this. That's what we'll be spending our time on. That's what we always spend our time on.
The Department of Health and Human Services Secretary Kim Peake said the overarching governance program of the hotel quarantine was had representatives from the Health Department, Jobs, VicPol, Department of Transport and DPC.
Yes.
And the decision to use private security guards was essentially signed off on by Emergency Management Commissioner Andrew Crisp under the recommendation from this governance group. Was it a rubber stamping of using private security guards, or did Andrew Crisp explore the issue?
Samaya, I think it's... I'm not being in any way critical for asking the question, but those are exactly the sorts of matters. So the rigour, the strength of the process or otherwise, what drove the decision, how it was implemented, who it was implemented by, whether it was done satisfactorily or otherwise, all of those questions are directly canvassed in the inquiry's terms of reference, and they will be allowed to go and do that work. So what I'm saying to you is that I can't provide you with an answer to some of those questions, and that's why I've gone and essentially engaged someone else at arm's length to go and get those answers, not just for me and you, but for every single Victorian.
Is there an opportunity for Andrew Crisp to hold a media conference as our Emergency Management Commissioner? He was a regular face during the bushfire pandemic.
He's got a slightly different responsibility in bushfires. Obviously, you didn't see much of the Chief Health Officer during the bushfires because he's got a different job. Again, he doesn't get.
But under the emergency management structure, he is the one with most authority.
Well, we can have a debate about flow charts and organisational charts. What I was about to say to you, though, which I think answers your question, he doesn't seek my approval to do media. What media he does is entirely a matter for him. So, if you want to speak with him, then you'd need to make a request of him. But he's a pretty busy guy, and I would just say to you, he's issued a statement today. And as far as I'm concerned, I'm not really interested in spending any longer having these having these debates with the Commonwealth, with a Commonwealth Minister. That's not really what this is about. Politics, furthest thing from my mind. pandemic is what we've got to be focused on, and that's what we are exclusively focused on, and that's why, you know, it's for others to comment. I try and be as frank as I possibly can here. I'm hopefully not doing anything other than that.
My question wasn't about Linda Reynolds' statement, though. It was about the Kim Peek's evidence to PAEC.
And then it became a question, I think, Samaya, about whether Andrew Chris would speak to you. And I'm saying to you that I don't control his diary, and he doesn't need my approval to speak to anybody. He speaks to whoever he believes he has the time and the need to speak to.
Yeah, I'd like to just ask about aged care. There's some
Certainly.
concerning reports today that residents who've tested positive to COVID-19 are being asked by the centres, by their treating doctors, to be moved out to hospitals where they can receive better care, and instead they're being kept sedated in their homes.
Yes, I've asked some questions about those reports, and the advice that I have from the team of people who are directly responsible for this, that meeting that occurs each and every night to go through what's occurring on the ground, what might need to be done overnight. Transfers to hospitals, the notion that people are being refused, that's not the advice I have. I'm advised that those judgments, very complex and difficult judgments, I think the facility that's mentioned is at least a large portion of their residents have got a whole range of very complex conditions. The notion of moving a dementia patient, let alone very large numbers of dementia patients, is very, very challenging.
But if the GP who's treating them suggests they should
Well,
be moved to a hospital...
Well, again, the
they'll
advice
offer
I've got is that the decision for them to stay in place is a decision made by... That's a medical judgment. We've checked with the Royal Melbourne Hospital, and we just don't think that that's an accurate statement. I'm happy to continue looking through that. We don't want anyone to get anything other than the best care. But, you know, there are some in this industry who would like to have all of their residents no longer under their roof. That would be easier, perhaps. Well, they're not judgments that are about what's easy. They're judgments that are about what does the clinician, what does the doctor and others, what do they determine is in the best interest of that resident.
This is a GP who's been expressing concern, though. It's not the aged care facility.
I think there's some comments been made by the facility as well. But in any event, we've checked with the Royal Melbourne. I'm happy to keep checking. We don't want anybody to get anything other than the very best care. And the mere fact that the number of residents who are being transferred to hospitals continues to grow each day would indicate to me that our clinical staff are making very difficult judgments based on clinical need and based on the circumstances of that particular resident. For some people, it is much better, much safer to be treated in place rather than to be moved in what can be an incredibly traumatic and sometimes fatal move. And we know this. We know this. I know this only too well, having been involved in more aged care upgrades than most. The amount of planning that has to go in to move high care residents from one facility to another, it can be a very, very traumatic process. So I don't make those judgments. There's no politician making those judgments. Doctors make those judgments. And I wouldn't want anyone to be in any doubt. We have sufficient capacity. We have created additional capacity. We've transferred a lot of residents, and anyone else who a doctor determines their clinical need means they need to come to a hospital, they absolutely will. And we'll then provide them with the very best care that we possibly can.
That
Yep.
medical
Question,
decision-
please.
That medical decision for dementia patients,
Yes.
is that being made, you said you don't want them to have anything but the best care, but clearly they're a risk, being brought to hospital where they could wander and they don't necessarily understand the process, reach out to staff. So
Sure.
is that decision being made to protect staff as well as the patient? Because there are a number of people in aged care who might benefit from hospital care, but I'm just asking a dementia
No,
patient
well,
being blocked at all.
no, that's clinical need is just that. It'll be the needs in a clinical sense of that person. Because, Mark, the key point here is if a resident were exhibiting that sort of behaviour, well then they're just as likely to exhibit that behaviour in place, so in their home, as they would be in a hospital ward. That challenge travels with that person, and that's the nature of this. You've got a lot of people with very complex needs. You've got a lot of people who it would be, in the judgment, not my judgment, in the judgment of the treating clinician, it would be much more traumatic and less safe if they were moved. If those decisions are not made, though, however, the decision is, look, given shared bathrooms, let's give you a few examples. Shared bathrooms, really big infection prevention and control challenge. Given the illness of this particular person, given the preferences that they have already expressed, for instance, for intensive care, that's a right that belongs to every single Victorian and has done since the mid-80s through the Medical Treatment Act. All of those things will be weighed up. The number of cases in a given nursing home, how stretched the staff are, all of those things, they would be considered against or as part of an assessment about how best can that person's their clinical needs be met. They're not easy judgments to make, but they're made after consideration and not by politicians or non-clinical bureaucrats. Doctors and I'm sure to a certain extent nurses play a part in that. And if they deem you need to be moved, you get moved. And that's why there have been, what was the number I just quoted you, mid 400s. And indeed there's probably some transfers going on as we speak.
Brendan, can I just take you through some basic questions? You have answered them, but we get hammered every day, I'm sure every media organisation does, with stuff about contact tracing.
Sure, I will try to answer your question.
They're pretty simple, but...
I'm grateful for your acknowledgement that I already have. That's good. I'll just have to remember and I'll come back. Yep.
One we get hammered with all the
Sure.
time. How do you define a close contact? What should people expect the definition of a close contact to be?
There's definitions around 15 minutes face-to-face or 2 hours in the same room. That's the nationally agreed definition. Sometimes through an abundance of caution, people will they'll cast the net wider than that. When I say people, public health teams will cast the net wider than that. That's the general rule. That applies, I think, across the world, and it applies certainly in all in our response and indeed states, other Australian states.
If I think I might be a close contact, but I haven't been contacted by the health department, how long should I stay at home?
Well, look, I think the first thing, if you are of the view that you may be a close contact, and even under the most efficient system, the metric is that you ought to be contacted within 48 hours of the laboratory telling us that the person who's positive that you may have been in close contact with is positive. So even if we did everything to the spec, that'd still be two days. I suppose that from an abundance of caution, isolate until you're contacted, but you can contact the person who's positive. You can also contact the department, and I know and understand that.
Because that's the question as well. A lot of people are worried that if they call the health department to find out if they're a close contact, they're just gumming up the system. So you'd encourage people to call the department if they think they're a close contact?
There are online as well as telephone services. Yeah, let me get you all the numbers, and if you want to put them on your program this afternoon, that's good.
And just two more.
And I would say there are lots of calls coming in, of course, but there's also lots more people. Each week those teams grow,
yes.
And we try and have calls answered as quickly as possible. But it's a bit like PPE, when everyone's trying to do the same thing at the same time, and
sure.
it does become challenging. I'm not for a moment saying that the phone will be answered on the second ring, and you'll
encourage the call.
Yeah, absolutely. If people are in doubt, we're there to provide not just rulings and rules. We're there to provide support and care and guidance. And the other thing too is that's where the door knocking is so important as well. All the cases get the knock on the door, not just to check that they're there, but also, have you got everything you need? Do you understand what you've got to do over these next 14 days? And as that, again, back to the point about ADF, with more than 500, and we'll get an update, I'm not sure how many of those are here, but it's more than 500 extra, and they'll be very close to the full contingent. They will then move with health department officials to door knock all the close contacts as well,
yes.
Those that should be isolating. There will always be that group that perhaps have a doubt, maybe I'm a close contact. They're a little harder to deal with because they're not necessarily in our system, but they've got a concern, and that's great. That's a sense of ownership and a sense of wanting to do the right thing. Let me get you all the phone numbers and websites and all the detail, and you can, if you want to push that out, that'd be great.
I'm just hammering you with these questions because it's quite hard to get anybody on the radio, so forgive me. Just two on the 5K limit.
Sure. I'm on your radio every day, I reckon, because I'm here for an hour and a half most days.
If my grandchildren live more than 5 kilometres away from me, can I go and look after them to help out the parents?
If you are part of a routine caregiving arrangement, then yes. But I think the Chief Health Officer has been very, very clear about anybody in that older age group should be extremely careful about moving around the community. That's been a very consistent position for months now, not just as part of the second wave, but I think we've tried to provide that advice right across the board. We do know that if you are older, particularly if you've got underlying health conditions, although not exclusively, no one again should think this is just a condition and a challenge for older Victorians. It can affect all of us.
Yes.
But you've got to be very careful with that. But that needs to be an existing arrangement.
Sure.
I think why don't I get you the exact words that we've put out? There's some frequently asked questions. I know that it's evolved a bit, childcare, because it needed to, and there is a set of words. I'll get them for you so that neither you nor I are saying anything that isn't 100% accurate.
Just one more that I think is more definite. If I'm the primary carer for someone who's
Yes.
elderly or disabled, they live more than 5 k's away from me, but I'm their primary carer.
Yes.
I can travel more than 5 k's.
Caregiving is caregiving where it is absolutely essential. So it would need to be what's needed, not what's normal or what would usually be the case. So I suppose it's about people making those, and this gets back to the point about millions of different choices that are made every single day by hundreds of millions of choices that are made by every single Victorian every single day. I think you'll find, and I'd be confident just in speaking with people that Kath and I know, people are visiting perhaps less often, people are getting somebody else who lives closer who might be young and doesn't necessarily have an underlying condition to go and do that caregiving. People are making different arrangements, and that's why we're so grateful to them, because it isn't easy. Caregiving or giving or getting care is a permitted reason to be out of your house, and it is a permitted reason to be more than 5 kilometres from your house, but we want a situation where that's driven down as much as possible.
Can I pick up on...
But again, let me get you the exact phrasing, because there are words and they are on a website, and it's important. Haley or Steph will follow that up for you.
I'd like to pick up on one of Raf's points and ask a question myself. Older grandparents, another question that we frequently get asked is, my parents aren't that old, they're either in their late 40s, early 50s, and they have grandkids. What's an older Victorian?
Oh, well, I think...
Without
Now,
being ageist.
see, that's the toughest question you've asked me for a long time now, because no matter what answer I give, that will not be the right answer. I don't know that that Professor Sutton has necessarily come up with a universal definition of what an older person is. I think that people, it's much more a function of your general health, and if you've got pre-existing conditions, which as a percentage of the community, those in their more senior years, so beyond middle age, are well and truly overrepresented in the chronic disease cohort. So that's what we're really saying. But I'm terribly saddened every day to have to read out large numbers and growing numbers of people that I don't think any of us would debate that they were older Victorians, and their families are planning funerals at the moment. So each of us need to be very, very careful.
Premier,
Is it likely that Geelong, Shepherd and Bendigo now, is it likely that those towns will also have to enter stage 4 restrictions given the increase in cases there?
I wouldn't say that. I think with 512 cases in regional Victoria, those numbers are quite low. Dedicated public health teams that have been established in a number of those regional centres that you mentioned and others mean that we've got that local knowledge, a local perspective that I think means our response is even better. And by and large, the reports back and the compliance data shows us that regional Victorians are doing the right thing. So I'm not so much, I didn't mention it off the top for any other reason than just to make the point that there are different rules in regional Victoria, but they're really important and they have to be followed by every single regional Victorian. And for the purposes of people travelling to and from regional Victoria, they've got to be followed by those people too. So I think regional Victorians are well and truly equal to this. It was just a way of reminding everybody that the rules are there for a reason. I wouldn't for a moment interpret what I'm saying as likely next steps or anything like that. We've got a long way to go, and this gets back to you know, whether it's points about the grand final or where we'll be next week or modelling versus theoretical modelling versus actuals. One of the great frustrations with this is that we can't tell where we're going to be in a week, and we certainly can't give you a definitive answer on where we'll be in a month or 2 months.
Yesterday we saw a departmental official stood down for allegedly scheming to sell alcohol to
Yes.
vulnerable alcohol-dependent people in hotel quarantine.
Yep.
Does that show that the government's still incapable of properly managing hotel quarantine, even after a complete overhaul, and even though we don't have overseas arrivals in the program anymore?
No, Rachel, it shows that that person has allegedly been involved in appalling conduct, and because there's a zero tolerance for that sort of conduct, he's been stood down. The circumstances of that will be investigated. That's appropriate, I think. The notion of procedural fairness is very important, but that person has been stood down, and we won't hesitate. His superiors, the Secretary of the Department, won't hesitate to act against him if any of those matters are proven.
What position did he hold?
I'm not sure which position he. I'm not certain as to what his VPS categorisation was or the exact job title, but I do know that it is alleged, it is thought that he was behaving in that way. That's totally unacceptable, shameful actually. He's been stood down. It's the appropriate thing to do. It'll be investigated, and then we'll be able to tell you more about what happens to that person. Sorry?
Can you be certain that type of behaviour wasn't more widespread?
Well, the fact that the very swift action has been taken against this person is the appropriate thing to do. I certainly don't believe we're seeing that sort of behaviour. But again, part of this is the Secretary of the Department will need to satisfy herself that this one incident is just that it's a single incident and that there are no other issues.
Are you confident that in many cases very vulnerable people who are in hotel quarantine now, the vast majority of people of whom have coronavirus are safe in that environment, given what happened in hotel quarantine, 2-3 months ago?
Yes, I am, because I don't think anyone's ever, well, not to my knowledge, I don't think anyone's ever criticised the care and support that's provided to people. There have been clear deficiencies in some of the security arrangements, but they're a very different thing.
Well, and the infection control arrangements.
Well, yeah, as you say, the vast majority of the people you're referring to, I think, Rachel, have got the virus now, and we've got a pretty good global picture about the unlikelihood of being infected twice.
People who work with them who are working in those hotels.
No, I don't think we're not.
We hope.
We're not, indeed. We're not at odds. If you're asking me, am I confident that people are that everything that can be done to keep people safe and to keep people fed and supported, and there are many vulnerable people there, and they have many varied needs, some very complex people that are in there, and I'm confident that we are providing for them. What went on allegedly with that particular individual is a shameful thing. He's been stood down, and if these things are proven, he will be sacked. Let's be clear about that. There will no longer be a job for him if what he's alleged to have done is proven that he did it.
There's mounting evidence that super spreaders are key to this pandemic.
And then we're going to go over here.
Suspect perhaps 10 to 20% of people responsible for 80% of new cases. Do you think this is a feature of the Victorian, like this, what's happening in Victoria at the moment?
Oh, look, I wouldn't make what is essentially a clinical judgment on that. There's a lot being read. I've read some of those papers myself. What I'd say, again, as I've tried to say a few times now, this is a public health bushfire, but you can't smell the smoke and you can't see the flames, and a spot fire, even just one spot fire, can become an inferno, particularly if people are not making the right choices. That's why the rules are so important as the kind of fail-safe, the backstop against lots of movement, and therefore that one case or a handful of cases ultimately becoming hundreds and thousands of cases.
But I guess I was just trying to ask.
But super spreader, I suppose what I'm trying to say is that yes, it is absolutely a feature of this virus that a small number of people can infect a very large number of people. I don't think that's presenting any differently here than it has in other parts of the world, but on that matter, the people who are best placed to give you that answer more definitively, rather than a sense of it, would be someone from the public health team. So let's, if they don't come back to you, then I'll come back to you when I stand here tomorrow.
And
Premier,
this is just a
one
question.
last- sorry.
But let's let Samaya finish this point, and then we'll go. We're going over back here, and then over here.
I know how busy they are, and this isn't me trying to shade or shame them, but do you have any idea when we might get either Professor Sutton or Professor Cheng of presses?
I think
We
that.
miss them.
Well, very good. I'm very pleased that me being here is not enough. That's fine. No, we'll get somebody from the public health team tomorrow. I think that's just a matter of other things they were doing, other meetings that they have to be part of. So, yes.
2 points that you raised earlier in the presser about health workers. So you said that there are 1,079 active cases among health workers at the moment, and you said
Yes.
most of these health workers are acquiring the virus outside of work. But can you quantify that at all, or give us a percentage?
Certainly more than half, but I don't think it's much more than half. That's the early work, and that's the point I tried to make, that there is quite a bit of work that has to go into trying to determine exactly what the source of the infection is. So we know who the people are, we know what they do for a living, we know they're in a high-risk environment, but despite all those factors, we are seeing evidence through those interviews, through the work we've done, that they didn't get it at work, they got it somewhere else. Let's call it, for the purposes of clarity, let's say it's half. That's what our early analysis is showing. But there's a lot more work to be done on that, so we can give you the fine detail, which, as I said at the outset, I'm hopeful to be able to do early next week. And if I can do it earlier, then I will. The other thing too is that you'll have some health professionals, health workers who are getting it from patients. You'll get some health workers who are getting it at home in the general community. The number of mystery cases means that that's what happens. You'll also potentially have one health worker giving it to another health worker. Again, there's no judgment in any of this. That's just the logical list of places where it might come from. But the early advice to me from the public health team is that, and those who are doing that detailed analysis, is that more than half, but just for the purposes of argument, let's say it's half those cases do not relate to the clinical setting. That's got to be further teased out. There's got to be more work done. But that work's coming, because I know that it's of genuine concern, and I want to know those answers as well, because if there's anything we can be doing, anything whatsoever, to add to the safety and the security of our health workers, then of course we would waste no time doing that.
Leading on from that, so your earlier comment, just to clarify that I understand you fully, you were saying the majority of healthcare workers are acquiring those cases outside of work. You've clarified that to say a little over 50%, so it's actually much closer to a 50-50 split. Now, PPE concerns have been raised repeatedly, and every time concerns about health workers have been raised through PPE, you and the Prime Minister have rattled off a very, very high list of gloves and surgical masks and face shields that you say are ready for distribution. But a repeated concern raised by health workers has been, well, we have masks, but they're not the N95 masks. They're not the right type of mask to protect us when we're doing our job in the hospital. So, I don't think this has been quite addressed in the public answers about PPE. There is equipment available, but a lot of the doctors and nurses are saying it's not the right equipment, it's not the adequate equipment to stop them from getting the virus.
Well, again, the protocols for what equipment is appropriate for what setting is not a matter that a politician determines. They are clinical judgments. There can sometimes be different views about what the appropriate clinical landing is. I'm more than happy to have somebody from either the Andrew Wilson, the Chief Medical Officer, or somebody from the Public Health team, or somebody else from the department to speak with you, to provide you with any answers to specific questions that you have. I think the fact that we have, so you order PPE, N95 masks for instance, let's say Monash Health out at Clayton, Monash Medical Centre. They order X thousand N95 masks before 11 o'clock today, they receive them tomorrow. They then distribute them to wards, they distribute them to all of those who need them. That's 98%. That's a pretty good turnaround, and we should be striving to get to 100%, and that's exactly what we'll do. But the distribution of these things in a very big system will always be challenging, but I suppose if you look at it, where might any issues come from? Do we have enough product? Is it getting where it needs to go fast enough? I think I've probably dealt with those issues. Yes, we have enough product. Yes, we're getting it out literally as quickly as we possibly can. Is there a unanimity of view around the clinical protocol? Probably not. Probably a few debates and discussions about where different PPE is best and where it's maybe not purposed as best as it could be. That's not something that I can resolve, but I'm more than happy to go back and follow it up with those who are in charge of those matters, just to double and triple check that all the points where there might be a problem, we're doing everything we can to address that. And if that means we need to provide you with further information, I'm more than happy to do that.
I guess the concern that I've seen raised by healthcare workers is that they're in a hospital, they're at high risk of contracting COVID because of their job, but they say, well, N95 masks are only provided to, say, you know, doctors and nurses in the specific COVID wards. On my daily round, I'm not getting the right kind of protection, I'm not getting adequate protection, and then we're seeing all these increases in healthcare workers getting the virus, about half of which are coming from hospitals. So do you think that there's some clear deficiency here, even though you're saying that there's lots of PPE and it's being delivered?
No, I don't think there is, but what I'm happy to do is go and test that and follow that up. There will be, you know, there's not, you can have, just bear with me one moment, because it is important that we deal with these issues as fulsomely as possible. Sorry, I'll just find the relevant page. Despite the fact that we have either got or distributed, so we either hold, have supplied or have on order 42,253,200 N95 masks, there's potentially never enough N95 masks for literally every single person at any risk at all, even a very low risk, to necessarily have one of those masks. So that's, I think, probably at the centre of the challenge that we face. But I'm more than happy to go and speak with those people who do make those judgments about what should be worn, where it should be worn, who should have it, the circumstances in which they should have it. I'm more than happy to go and test that and try and make sure that at the very least, that's the other point that I didn't mention, if you were to do a list of things where things might not, where a problem, if there were one, could come from, the notion of inconsistency would be the other thing you'd look at. But that's why the PPE task force, hospital administrators, CEOs and others, the advice I have is that there is a great deal of consistency about those protocols. Why don't I take that offline, and if I can come back to you with any further detail, I'm more than happy to do that.
Premier, just two questions from me quickly. Sorry.
Sure.
The latest coronavirus case in Tasmania was a man who had received treatment, hospital treatment in Victoria, then came back tested positive. Now, what does that say about our hospital system here? And can people feel safe admitting themselves to hospital, feel safe of not getting the virus, essentially?
I'll just very, very quickly to the earlier point, the 50% number is not me wanting to downplay the need for PPE. That's just what the data tells us. Nothing more or less than that. Even at 50%, we know that our health workers are heroes and are putting themselves in harm's way, and that's why these matters are really important. I think Victorians, not just my view, but what the public health team and what the public hospital team tell us is that people can be confident that every step is being taken to keep patients and staff safe. I think what that case tells you is that this is a wildly infectious disease, and that's why we've sadly had to cancel elective surgery in many cases to create capacity, because we know that there will be more and more infections and there will be more and more people who need hospital care. I wouldn't read any more into it than that, but there could be some specific circumstances to that case that I'm not briefed on. So I don't have any more detail on that than you do.
And just on the border towns, are you concerned about a looming health crisis, I guess, given the restrictions New South Wales has imposed on Victorians?
In a COVID sense or in a general health sense?
In terms of the health care there, say, for example, a Victorian can't travel into New South Wales and vice versa. Are you concerned that there'll be healthcare shortages, I guess?
Oh, look, I think it's clear that we've had some challenges, particularly staff in our northern Victorian hospitals who live in southern New South Wales. That's something we continue to try and work through with the New South Wales government. It isn't easy, but I'll give you an example. We actually run health services in Albury. They're not run by New South Wales. It's part of a joint Albury-Wodonga health service that we took over some must be the best part of 11 or 12 years ago. So we actually, I think that's correct. We run that. I know we run the hospital. The timeline might not be correct, but certainly for a long time we have run that place. So staff and patients don't have any choice but to go there, and I think there are accommodations being made for them. I haven't had a report in the last day or so in relation to border issues, but I'm happy to chase it up for you, and if there's anything I can add, then one of the team can speak to you afterwards.
Sorry, you haven't commented on the 11% unemployment and 325,000 potential job losses. Is that as bad as it's going to get? I mean, that's much more dire than what we thought the first.
Well, it is heartbreaking. I spend every day in this job creating jobs. I spend every day in the job that I have creating jobs in every sector, in every part of our state. It is heartbreaking to think that so many people are going to be without work, a large number that will have less work than they would like to do. But the key point here is that if we don't have these rules, if we don't fix this health problem now, then we simply won't be able to begin the process not just of opening up, but of rebuilding businesses and livelihoods and getting our state strong again. These are not numbers. They are thousands and thousands of stories of hardship and pain. And that's why none of us can afford to stop. This virus doesn't. There's a big job to be done here. It's also why none of us can afford to be playing political games. I'm just not interested in that. I'm interested in fighting this virus and no one else. That's what's the really most important part of the relationship I have with the Prime Minister. It is about a partnership, a shared aim, a shared goal, and a shared purpose, and that is to get to the other side of this.
Premier, cancer pathology notifications fell by up to 120 people, or 28% between March and May.
Yes.
Are you concerned about more people dying of things like cancer while we're focused on COVID?
Cancer screening across a number of different tumour streams has been a concern that's been raised at National Cabinet, and my last update on this was actually before the change from Brendan Murphy to Acting Chief Medical Officer Paul Kelly, and Brendan and National Cabinet spoke about the resumption to much closer to normal levels of testing in a number of different programs. I'm happy to that. They're all national programs in the main, but I'm happy to try and assist you in getting some answers and clarity on at what rate those national programs are running.
Premier, who was at the meeting on the 27th of March at 4:30 p.m, during which ADF support was rejected and private security was decided on? The Secretary of Department of Jobs says he was there, so I'd just like to know who else was there and then who, of course, made the decision to reject the ADF at this meeting.
Well, again, we're back to where we started. You're talking about March.
March 27th.
Yeah, well, indicating that there was a rejection of ADF support is directly at odds with what Emergency Management Commissioner Crisp has confirmed today. And again, I can't require you to take notice of that statement. You've got to make that choice. But that statement's there, and I think we've had a couple of questions now where it's almost as if that statement doesn't exist. It does. It was put out this morning. And I don't know that you can have any fair interpretation of these matters without drawing your own attention to that and spending some time looking at that. That's a thing. It's real. And I really can't add any more than that. I certainly wasn't at that meeting. But what occurred at that meeting, and again, I just make the point, it is completely wrong to characterise that as a rejection of anything. Mr. Crisp, Commissioner Crisp, someone who I have a great deal of regard for and confidence in, someone I deal with very regularly, someone who I think Victorians know and understand to be a very, very good servant of safety and of the public. He's made a statement. It's very clear, very, very clear.
Premier, just on New Zealand, you spoke
Yes.
before about fixing the health problems. Does New Zealand's outbreak show that we can't really fix it, and what does that mean for Victorian situation in terms of the long-term effect?
Sure. Well, I think they've gone into a 72-hour lockdown because they had, I think, 4 cases. I'd send my best wishes to everybody in New Zealand. This will be a challenging time for them. Whenever you have to impose lockdowns, it's very hard. But it just, again, speaks to the fact that this is a silent enemy. It's a wicked enemy. And even when you perhaps think you've got it beat, it'll be there. It doesn't go away. It's really, really challenging. Now, the exact nature of what's occurred there, I can't speak to that. That's what they'll be doing. They'll be tracking and tracing. And I think they're doing a massive testing blitz to try and see whether there's other cases out there. But yeah, this is a wicked enemy, even for those who, after many days of zero cases or very low cases, turns out that there are some there.
Is it disappointing in a sense that I guess we all looked at New Zealand and thought it can be done, it can be beaten,
Sure.
it's gone.
Sure.
But
I wouldn't say that yet. There's a small number of cases. Let's see how the 72 hours unfold. And again, I'm not here sitting in judgment on New Zealand. I haven't got time for that. And we've got a big job to get on with ourselves. We wish them all the best. And to the extent that it's relevant to us, I think that it just, again, reminds us, if we needed any reminding, that unless you get these numbers down to pretty low levels, and sadly I can't give you a number, but unless you get them down to pretty low levels, the degree of confidence that you can have that you can suppress and really stay on top of any additional cases is low. You've got to get the numbers down, and that's why we've had to make these heartbreaking decisions about limiting movement. That's why we've got these terrible projections about unemployment. That's why there's so much hardship and pain in the community. But there's no choice until we get the movement down, numbers down, cases to but a fraction of what they are now. Then there'll always be that quite substantial risk that a third wave is only short time off. That's almost inevitable. We want to try and do everything we can to make sure that doesn't happen. So low numbers based on really low movement is exactly the decision to make, and that's exactly what we've done.
Just quickly.
Sure.
You said that there was more than 500 people that have now been referred to Victoria Police. I assume these are the people that were found weren't at home when they're meant to be isolating. Yep. Just wondering if there's an update on fines.
I think what's going to happen is we're going to do a one-out briefing for you. So I think that perhaps separate to my appearance here every day, I think we're going to get a couple of senior Victoria Police members and potentially the Minister, and they'll sit down and take you through the whole picture, because there's lots of different groups, obviously. Curfew, businesses that are open and shouldn't be, people who are out shouldn't be, outside curfew hours, and then there's the issue about door knocking and people that couldn't be found where they were. Again, I'll just make the point though, that referral number, that's a matter of fact. That's how many people were sent to Victoria Police. How many of those have ultimately been issued with a fine, that is to say, didn't have a lawful excuse for not being behind the door we knocked on? I haven't got an update on that. But let's get you, what they're talking about doing, I think, is having if you like, a enforcement briefing, so they can take you through all of those different issues.
And about a week ago, it was looking like 1 in 4 people weren't home when the ADF were knocking on people's doors. Is that still
I think those
that
numbers
high?
are coming down. Those numbers are coming down. So the last update I had, I have had a couple of updates since then, but the last one that I can recall at the moment was 1,150 door knocks in a single day, which was their biggest day. They've almost certainly beat that now. And there was 1,000 that were home and 150 that weren't. So that's, I think, really positive. And that's what's driven, I think, some of the commentary that certainly I've tried to make in recent days about, I think, a growing number of Victorians are doing the right thing. And that's critical. If we don't see those really high compliance numbers into the 90s, then you've always got that inherent weakness in the strategy that your public health teams put forward. They can come up with the strategy, but we have to make sure it works. And when I say we, it's not just the government, it's every single Victorian. And that's why it's really important to see, I think, more and more people doing the right thing. The key point here is, if you've got symptoms, get tested. Stay at home till you get your results. The rules are there for your family and every family, and they're there to protect our health workers. If you value them, if you don't want a fine, if you want this to be over sooner rather than later, please keep making good choices. If there's no other questions.
Sorry, I've got one.
No. I was making no.
This will be quick. Yesterday we had a huge number of young Victorians revealed to have
Correct.
active cases. Do we have any idea of the breakdown? There's a huge number of people, say in their 20s and 30s. Are they the healthcare workers, the meat care workers, or are they other people in the community? Do we know?
I think that, so you've got about, again, I haven't got the statistical breakdown in front of me, but you've got sort of 15 to 44 is about half, 40 to 50% of cases, if not more. does jump around a bit day to day. I think that just logic tells you that if people of working age are driving a large percentage of the cases, then that will be people who are, certainly in the last week, they'll be permitted workers, because if you're not permitted, then you won't be at work. And the chances of transmission in your home, if you're working from home, obviously less. Show release later today. If we can go to a bit more of that detail, we're happy to try and give you some. I'm sure that it's there, just a matter of I don't have it in front of me now.